Hello and welcome. Thank you for joining us. We are very excited to talk to you during this session about a new initiative that AXYS is supporting called the Galaxy Registry, generating advancements through longitudinal analysis in X and Y syndromes. I'll start by an introduction. Myself, I'm Dr. Davis. I am a pediatric endocrinologist at Children's Hospital, Colorado, and I do research in kids with X and Y chromosome variations, as well as participate in the Extraordinary Kids Clinic. And my colleague, Susan, is going to introduce herself.
My name is Susan Howell. I'm a board certified genetic counselor for the Extraordinary Kids Clinic at Children's Hospital and an assistant professor at the University of Colorado School of Medicine, as well as a board member of AXYS.
All right, and our objectives today are to talk to you guys about the research for the future. We're going to start off by just focusing a little bit on introducing what is research and why it's important. And then we're going to talk about a specific example of a registry that has really made advancements in a different syndrome or a different condition called Fragile X syndrome. We're going to talk then about how Galaxy is going to benefit the X and Y community and how you as families can participate. So our overarching goals, not necessarily just for the Galaxy study, but in general, when we talk about research, are to be able to engage the X and Y community in all stages of research, from developing research questions to how we collect the data, to participating in research, to analyzing the information that we get and to disseminating it to the community. We also want to study questions that are important to individuals and families to ultimately make a difference for those people that are involved. We want to support collaboration and sharing data across centers, and we want to develop a sustainable infrastructure that will support future fundable research. So taking a step back, what is research exactly? Research is the systematic investigation in order to describe, explain, predict, control, and observe phenomenon with the intent to contribute to generalized knowledge. So that's a whole bunch of words. Let's break that down a little bit. Systematic refers to using the scientific method and also conducting this procedure with ethical standards. Investigation means to answer a question through studying something. And then finally, contribute to generalized knowledge. This refers to the information that we're seeking and the conclusions that we're coming up with need to apply to more than just one person or one situation. They need to be generalizable to a larger group. So why is research important? First of all, research contributes knowledge about health and disease. This can be just observation, natural history of outcomes, or what is happening to a particular individual or individuals with a condition, what ultimately causes conditions or risk for conditions and who is at risk. And then also something we call biologic plausibility. So to understand the underlying biology or pathophysiology behind why something happens. Research also allows us to test and develop treatments or approaches that ultimately leads to clinical decisions, including what works, what doesn't work, and what are the risks and benefits involved. And then ultimately, we want to be able to take what we learn from the knowledge about health and disease and the potential treatments or approaches to ultimately improve the health and well-being of people through prevention or curing disease, treating conditions, or improving quality of life. Now, none of this is specific to X and Y conditions, but we're going to get there. There is lots of different ways that research in health can look. It starts off way over here, what we call T1 or even pre-T1 is preclinical. So humans aren't even involved. It is just animals. And then we start to test maybe some treatments in animals. So translation to humans, but not necessarily patients. They're just humans in general. And then to patients, and then to practice, and then finally to a population. When we're talking about the registry initiative here today, we're over in this realm, in the T3, T4 realm. So this is one example of why or how research is important in X and Y conditions. You guys have probably heard of the birth cohort studies that were conducted in the 1960s and 70s in multiple different cities across the world. They karyotyped babies that were born during a specific time period in all of those cities and identified babies that had X and Y variations. And then they followed them over time from infancy to childhood to adolescence into young adulthood. And these studies really told us a lot about growth, development, and outcomes in individuals with X and Y chromosome variations. And this is really the foundation of where a lot of our additional studies have come from since then. I'm going to turn it over to Susan to talk more about specifically registries in research.
So what is a research registry? Well, a registry is a collection of uniform information about individuals with a specific condition. It's usually collected longitudinally, so that's ongoing over time. So it might be an annual collection of data or every couple of years. It can be conducted through either a single site, one institution, or multiple sites, multi-center or an organization, collecting information about individuals. It also can be data collected from either the researcher specifically or from patients, where the patients are entering their own information or both. Registries really serve to connect patients and researchers together in order to create more power in the research. Sometimes they collect and store tissue samples in combination with some of the electronic medical record information, such as a biobank, in order to really connect the clinical history along with information like genetics or biological samples. And the most important aspect of a research registry, from my perspective, is really being able to provide more power in a larger number. So if one institution is studying a condition and they only have 100 patients, all the reports are going to be on 100 patients. Whereas if you have 10 different centers with 100 patients each, we've got power of 1,000 patients, and that's much more scientifically rigorous. So why do registries matter? Why do you care about this? Well, participation in a registry is likely to increase what we know as a community, all stakeholders, about a specific condition. It serves to help healthcare professionals improve treatments, as well as allow researchers to design better studies on a condition, including developing and testing new treatments, such as clinical trials, as well as being ready to conduct clinical trials. I'd like to give an example of a registry that's used in another condition called Fragile X. So you may have heard about Fragile X recently. It's been in the news a lot lately due to successful clinical trials. Fragile X syndrome is the most common cause of an inherited intellectual disability. So this is not related to X and Y chromosome variations, but a completely different type of condition. But I'm going to give the example because they've been fairly successful with a registry. So it's a rare disease. About 1 in 4,000 males will have it, 1 in 8,000 females, and the average age of diagnosis is 36 months. So when you have a child with Fragile X syndrome and you don't necessarily know that they have it, that delay of 36 months without a diagnosis can be pretty impactful, as well as then prognosis, what happens once they get the diagnosis. And there's a lot of unanswered questions in the field of Fragile X. Understanding what the natural history of the condition is, what the prevalence of various problems are, medical problems, developmental problems, psychological problems, as well as there's a lot of limited information in regard to what happens with aging in our patients with Fragile X. There's a lot of unanswered questions in regard to medications and medication trials and success, as well as, is this a condition that should be on the newborn screen for each state in order to be able to identify these babies earlier? So the Fragile X Clinic and Research Consortium started back in 2010 and currently has, in 2021, 34 national clinics across the country serving in the Forward Registry. So the Fragile X Forward Registry, Forward stands for Fragile X Online Registry with Accessible Research Database. It started in 2009, and it's funded by the Centers of Disease Control, or the CDC. The registry enrolls all family members in a Fragile X family, but most specifically follows individuals with Fragile X syndrome. And in the database, they collect information in regard to in-depth clinical information about individuals with Fragile X syndrome, as well as longitudinal data. So over many years, information is collected annually. And it really serves to seek better understanding of the medical, social, and behavioral changes in individuals with Fragile X syndrome from infancy to late adult life. Collecting structured forms from both parents and clinicians, it's very rigorous in the application and uniform across the sites collecting data. And all of the data collected is de-identified. So information submitted into the database does not contain any individual identifying information from the participant. And you can see from the map that there's several sites across the country that are participating in this registry. So this registry, this forward registry in Fragile X has really been successful. Currently, there's more than 2,500 patients and participants in the database over the last 11 years. There have been decades of longitudinal data that's been collected since it is 11 years old, with many data points that are outcomes. There are currently more than 17 research publications, both published as well as pending, from the data collected in the database. And it really serves to help inform new treatments and therapies for individuals with Fragile X syndrome, as well as develop resources for families and demonstrate the need and direction for future research. It's been very instrumental in supporting many of the clinical trials that have been developed over the years, as well as ongoing success. And then launching the Fragile X Premutation Registry in 2020, just last year, as a secondary registry based on the success from the current registry and forward for Fragile X individuals.
All right, so we want to take what the success that the Fragile X registry forward, as well as other registries in both rare disease and common diseases in childhood and adulthood have had in advancing the science and ultimately the clinical care for these individuals. So we are developing what we are calling the Galaxy registry. Galaxy stands for Generating Advancements Through Longitudinal Analysis in X and Y Syndromes. And Galaxy is going to be a multi-center clinical data registry and biorepository, or a biobank, for individuals with X and Y variations, with the goals to quantify baseline clinical outcomes, like Susan was saying, identify the prevalence of different medical, developmental, psychological, etc. conditions, to determine the best clinical practices that maybe already are happening out there, and to support future research and quality improvement efforts that ultimately, with all of these goals, will improve the outcomes for individuals with X and Y variations. So a little bit about the players involved in Galaxy. So as we mentioned, AXYS is supporting the efforts for the development of the Galaxy registry. And there will be a steering committee that has different players, different stakeholders that can contribute and integrate different perspectives, both from the AXYS community perspective, the patient and parent perspective, the physician clinician perspective, and the researcher perspective. This steering committee is going to really set the agenda of what the Galaxy registry is going to set out to do, and develop policies and procedures so that we can have an agreed upon, how we use the data, what data we collect, and kind of the future of where we go from here. And the steering committee will certainly report back to AXYS about these developments. The ACRC, the AXYS Clinic and Research Consortium, individual clinics will all have an opportunity to participate as members of the Galaxy registry. They will continue to provide patient care as they already are, for the patients that enroll in the registry, the ACRC clinic members will then input the data into the registry that we develop in a platform called REDCap. They will also be able to use the data that they input for research purposes as well. And the role of the patients is very important, critical in the registry. Patients will continue to be seen at participating ACRC clinics, and they can then have the opportunity to decide if they would like to participate in the Galaxy registry. If so, they can consent essentially to use their clinical information for research purposes. They can also decide if they want to participate in other ways, which we'll go over in a little bit. A little bit more to the structure. Denver is where both Susan and I are at the Extraordinary Kids Clinic, and we will be leading or developing the registry itself from the platform of REDCap, which is a platform that's free for us to use and is all HIPAA compliant and is used specifically for research that other sites will be able to put the data into. It gives us full control over if we need to modify any variables that we're collecting or add variables. And it also allows us really easy access to take the data out at any time as well to use for research purposes. So what is being asked of me as a research participant or a potential research participant, a patient that's being seen at one of these clinics? You will have the opportunity to enroll into the Galaxy registry. And at that point, you can choose to do a basic enrollment, which is just nothing extra for you to do, just allowing us to use your clinical information for research purposes. We will take things like what diagnoses you've had, what medications you're on, test results, if you've had a neuropsych evaluation, etc. We can enter that into REDCap and update that each time you visit the clinics. We also or then your de-identified data can be used by researchers for projects that are approved by the steering committee. You also will have the option to participate in additional study opportunities, including being contacted for if there's new research opportunities that you might be eligible for. So it serves basically as a contact list. To participate in a couple of surveys that we would send out to you guys. And then the third one is if you're already having blood taken, if we can save some of that to be stored in the biobank for researchers to use in the future, that is another aim of the registry as well. Susan, I'm going to let you start here.
Okay. So many of you are probably scratching your head saying, wait a second, I did a registry. I entered information for hours online back in 2015. And you are correct. There was a previous registry called the AXYS registry. It was a pure platform registry that AXYS was participating with. There's several lessons that we've learned from that registry, and all of your participation has been greatly appreciated. The data is not lost. We have retained the data, and we are going to ask to consent for participation over to the Galaxy registry. But there are many differences that we have included into the Galaxy registry as lessons learned from the previous registry. And this is a very busy slide, so I've bold-faced just a few aspects that I just want to bring to your attention. In the previous registry, there was a significant burden on the participants to enter in data online. And so that's, as Dr. Davis just mentioned, that's not going to be an aspect of the Galaxy registry, that it's all going to be taken from clinical data and electronic medical records. That also allows us to have validated data from the medical records based on diagnoses and test results, whereas participant entered data from the previous registry was not validated from a scientific rigor perspective. There will be a steering committee that'll oversee the structure for the Galaxy registry, which is different from the previous registry. And then the fee structure differently. So the old registry was aborted when we started to realize there was going to be an annual fee instituted from the ending of the PCORI funding through the Genetic Alliance platform. And so this new platform using the REDCap database, which is waived, any fees are waived for academic centers, so there won't be an annual or accumulating fees. So those are just some aspects of the benefits of doing the registry Galaxy style.
I like that, Galaxy style. With that, there are certainly still ongoing costs to to setting up a type of registry like this and maintaining it as well. With the platform that we've designed, we are hoping that we will really be well poised to be able to submit grants and conduct research using the registry in the future, which wasn't necessarily going to be an option for the peer registry to sustain it. All right, so how can you support Galaxy and the efforts of Galaxy? So we would like to open up the design of a logo for Galaxy in a contest form. And we know that there are a lot of great artists out there, and I am not one of them. So if you're inspired by Galaxy and have some artistic talents, we would love for you to submit your potential logo ideas to galaxy@ucdenver.edu. And we will choose a winner ultimately, and that winner will be able to be named and recognized. We also are, as I mentioned, that the registry is initially supported by AXYS to get the funds up and running, but we want to continue this as well. And so if you find that this is really important to you and you think that it's important to the future for X and Y chromosome variations and the research that we're doing, I encourage you to specifically consider donating. And then we're going to be looking for a couple of patient and/or family reps to serve on the steering committee. So if this is something that you're passionate about, again, email us and tell us what your interests and perspectives and strengths might be that you could bring to the steering committee. And then beyond that, help us engage the community and other stakeholders in this initiative. And when your center opens, we would very much encourage you to enroll as a participant in Galaxy. In the future, we are also hoping to expand it not just to those that are in the center or being seen as a patient in one of the ACRC clinics, but possibly beyond that as well. And so stay on the lookout, stay up to date on the AXYS website. It'll have all of the most recent information. So with that, we will open it up for questions. Thank you all for listening and participating in today's session.
Thank you.